if 6 months after your first budget you are not meeting your own fiscal rules, then either spending has to be cut or taxes have to go up.
The Blair government was under pressure from people on their own side who said, this means privatisation.
The NHS is broken. We're going to change it. How are you going to change it? Well, we're going to manage it better than those other guys. Tony Blair and others realised that had been a total mistake. They'd basically done what the unions and the interest groups wanted them to do when they first got into power. Then they realised it didn't work.
Hello and welcome to the IEA podcast, where we try to get under the bonnet of the week's news and into the stories and issues that matter to classical liberals. I'm Callum Price, Director of Communications at the IEA, and today I'm joined by our Executive Director, Tom Clougherty, and our Editorial Director, Kristian Niemietz. So it's been a busy start to the year with all sorts of things kicking off in the UK and elsewhere. But the hottest topic at the moment, we could argue, especially for people interested in economics, but also people who care about the British economy, is the current crisis, if we want to use that word, in the cost of government borrowing. Tom, what's happening?
Yeah, I think crisis would be putting it a bit strongly, to be honest. It doesn't really feel like a crisis. I think the financial markets are operating in a normal and orderly fashion at the moment. What it is a massive inconvenience for the government because, yes, their borrowing costs are rising quite steeply, hitting sort of record highs, or at least recent record highs. And yes, borrowing costs for governments are rising around the world, but Britain is a bit of an outlier. It's happening more than you would expect here, given those global trends. At the same time, economic growth is flatlining. It looks like the economy was shrinking towards the end of last year. And remember that the Office for Budget Responsibility predicted at the budget in the autumn that the economy would grow by 2% in 2025. That now looks like an extremely optimistic figure. So when you have a lot of debt, and spending on debt interest is a big part of your overall spending, if your borrowing costs increase, that's pretty bad news. If the economy does not grow the way you expect it to, that probably means that tax receipts are going to be lower than anticipated as well. So that gap between what you're spending and what you're bringing in gets wider. Now, Rachel Reeves at the budget in October, I think it was, she didn't leave herself much headroom against the newly defined fiscal rules. I think she had a little under 10 billion. And you've seen reports in the newspapers and so on this week from economics consultancies and so on, that basically, if you sort of plug the current numbers in, it looks like all of that headroom is gone. And actually, 6 months after her first budget, she will be in breach of her own fiscal rules. Now, the fiscal rules, what do they really mean? I've said before on this podcast that I think they're largely a signalling device. They don't have a lot of value in and of themselves. I quite like the idea of fiscal rules, but if I was coming up with a fiscal rule, it would be completely different from the kind of ones that we have in this country at the moment. So in a way, she could do what every other chancellor has done and maybe just say, well, I didn't quite define the fiscal rule the way I wanted to, so we're going to change it. Or, of course, these fiscal rules, it's all about hitting a target which is always a few years into the future. So you can do the classic, yes, things look bad now, but actually we're revising up the growth forecast in later years, or we're penciling in really tight spending settlements for the later years in the Parliament so people don't feel spending cuts now, but they flatter the overall fiscal situation. You can do all of these things, but obviously the speculation at the moment is if 6 months after your first budget you are not meeting your own fiscal rules, there is a widening deficit and so on, then either spending has to be cut or taxes have to go up. Now, the government has basically I think more or less ruled out tax increases. Not sure I trust them on that. I might trust them on that for the next 6 months, but I don't think that that's really going to be their long-term position. But if there aren't going to be tax increases, and remember they made a big song and dance about the tax increases in the autumn budget being a one-off, a clearing of the decks. You won't see anything like that from us again. Business, you can feel confident under the government. Well, people are suddenly not so sure. But the implication of saying no tax increases, but also you had a Treasury statement, I think it was today, Thursday, Friday, whatever, and forgetting what day of the week it is. And quite unusual for the Treasury to come out and say this, but basically saying, no, the fiscal rules are super important and we will meet them. But we'll wait and see what the OBR says before we release any kind of policy announcements and so on. So Look, that's the situation. It speaks basically just to this all-enveloping cloud of negativity that surrounds the British economy at the moment. And yeah, there are global trends, but we look worse than most. And I think it's really important to try and get to the bottom of why we are so weak economically and not get into this vicious spiral where basically the fiscal situation keeps deteriorating, so you keep raising taxes and then you find growth gets even worse, and so you have more of a deficit and then you've got to raise taxes again. I think that we're in danger of just getting into precisely that kind of spiral, and that's something I think the government needs to be super, super careful about.
The problem with it is, of course, that these were supposed to be the good times. We talked about this before on this podcast here, that's what the OBR projection said, that initially there was going to be a short-lived boom, a year or two, where economic growth was going to be above trend, and this was supposed to be the relative short-lived golden age, and then comes the nasty bit. And if this is the situation now, then what is next year and the end of this parliament going to look like?
Yeah, and there is one interesting angle here, and as I said, there are all kinds of different things going on at once, as there always are in economies. But, we've published some work over the last year on broad money monetarism. I mean, associated most strongly with Tim Congdon, but actually it's sort of shot through the work to a certain extent of the Shadow Monetary Policy Committee here at the IEA. And it's a way of looking at monetary policy and macroeconomics that really thinks about the money supply, the broad money supply. And if you look back, I mean, the Shadow Monetary Policy Committee was predicting during the COVID era that these massive increases in monetary stimulus through QE were going to lead to inflation. You have massive broad money growth. And indeed, after the long and variable lag, which tends to be about 18 months, you got a massive spike in inflation. It went up into double digits. The Bank of England was very slow to respond to that, to raise interest rates, to tighten monetary policy. Things got a little bit out of control. Now, I think what's interesting and probably less remarked upon is that for quite some time now, the Shadow Monetary Policy Committee has been pointing in the opposite direction. So in autumn 2023, broad money growth actually went significantly negative. I think it was sort of minus 3% on an annualized basis. And that's very unusual for the broad money supply to actually contract. And what that tends to point to is that after another long and variable lag, so about 18 months, so about this spring of 2025, you will be looking at basically really, really sluggish nominal GDP growth. Basically, your economy in fairly dire straits. So probably low growth, probably low inflation as well. Now, I know we've seen a spike in inflation towards the end of last year. My guess is that won't be durable based on the monetary fundamentals, that it's to do with kind of passing factors and the way they measure it and everything. But of course, it has meant, according to the conventional way that monetary policy is done by the Bank of England, that they feel they can't cut interest rates, that they have to keep monetary policy tighter probably than the overall economic situation suggests. And it could be that we are reaping the consequences now, after a period of time, of monetary policy mistakes that were basically happening in the autumn of 2023. I think one of the reasons, I think monetary policy is an incredibly powerful factor in economic performance, and not in the real performance of the economy, by the way. I want to stress that. I don't think that monetary policy can just make the economy grow in real terms. But in nominal terms, it has a huge impact, almost a determining impact on the kind of nominal quantities that we talk about. But it's because the effect always comes so long after the action, for good or ill, that I think people tend not to join the dots. And so I do think there is an element of monetary policy in all of this, and that maybe at some point people will start to think, I don't think the Bank of England has done very well for quite a long time now.
Mm. But people are much quicker to point to the recent budget, which is controversial for other reasons, and just sort of pile the pressure in that direction without zooming out.
Oh, and look, I think there is no question whatsoever that the budget, and then all of the talk leading up to the budget as well, but particularly the sort of tax increases and the tightening up of employment rights and the rise in the minimum wage and all of these things. It was we talked about it on the most recently released podcast, a massive assault on business, which has undermined confidence. That was always going to, I think, depress things relative to where they would have been. It may just be that a lot of people thought things were going to be fine and that the budget would kind of knock a little bit off that relatively fine situation. I suppose what I'm saying is that my default assumption was that things were going to be pretty crappy in the spring of 2025. And then you add in a budget which hammers business, it looks a lot worse. And that could be where we're heading. But of course, it's very dangerous to make predictions.
We wouldn't dare. We wouldn't dare. Kristian, anything to add on that?
No, definitely not on predictions. I'm not going to go there.
Didn't think so. So from one difficult issue for the government to another, but somewhere where they may have made a little bit more progress this week, Kristian, the government have set out some more of their NHS reforms, and a bit of a mixed bag, but reason to be optimistic for classical liberals, do we think?
Well, there's one element in it that I actually liked. So most of it was more of the same. So they're saying we're opening 14 new diagnostic centers, and that's very much, business as usual, plus X, plus a bit more. And it shows the whole mindset that the health system is still very much centrally controlled. It's 14 new centers, not 13 or 15. It's got to be 14 of them. And they're also going to decide the opening hours and give them extra money if they open for longer. It is still very much thinking within the box, within the system. But there's one element which didn't get much attention because it doesn't sound like a big deal. They said, we will also upgrade the NHS app. We will give it extra features. We will make sure that you can use it to book hospital and specialist appointments. And, this sounds like a minor procedural change, but this could actually make a difference in that this is building on an earlier Blair-era reform, in that this is going to make it easier to choose between different providers. Now, the Blair-era idea was that when they introduced patient choice for the first time, so until 2005 or 6 or so, there was no patient choice beyond the point of being able to choose a GP. Your GP would refer you. They would say you go to the local hospital and that's it. There's nothing you could do about that. And in the Blair years, in successive steps, they introduced free patient choice after the point of referral, so the decision whether you get treatment at all. That would still be made by the GP. The GP would remain a gatekeeper, but it would then be like a voucher, you could say. The GP would give you the permit to book an appointment and then get the treatment that they seem fit for you. And you could choose where to get that. So free choice of provider. And what was good about that was that they combined that with a change in the payment system where, this idea that money follows patients. That was not a thing before. Before then, healthcare secondary healthcare providers and hospitals would just get an extrapolated budget from carried over from the previous year. So they would say, okay, last year you had £100,000. This year, let's say 105,000 or so. So they would just take the historical budget and extrapolate a bit into the future. They then introduced a system where hospitals were basically paid on the basis of activity. So if they attract more people, they will get more money. And in this way, the Blair government created something like an internal market. So simulating a market process within the NHS, and they even extended that a little bit, that freedom of choice would also mean that you would be able to choose an independent sector provider if they were willing to operate under the same conditions as an NHS provider and with the same payments. And compared to the way it was before, that was a minor revolution. It's just one problem with it was that it was never fully rolled out because most people just didn't know that they had this freedom of choice. And part of the reason for that was, I think, I didn't live in Britain at the time. I read about it later, that one problem was that the Blair government was under pressure from people on their own side who said, this means privatization. This is a Trojan horse. You're really flogging off the NHS. This theory, it's always been around. It was just, that was the Blair era incarnation of it. And since they were susceptible to those accusations, they kept it quiet. They introduced patient choice, but just didn't tell anyone about it. And what happened then was that most GPs would just continue referring people as they saw fit. And I believe for a while that over time it would just take a while to settle in. And at some point, free choice would become the norm. But if anything, it's gone slightly into the reverse. That's what the government said in this week's announcement, that there are surveys on this. You ask a hospital patient, have you been told that you can choose, or have you just been referred? About 3/4 of them say, well, what, I can choose, really? And it's only been very imperfectly implemented. It's been an improvement as far as it went, but there's more that you can do with this reform once you have the basic outlines in place. Ideally, the Cameron government, I guess, should have just said, well, Blair was actually right about this, and we're going to build on this rather than trying to start something completely different. If they can now use the app to make patient choice something meaningful, then this would be building on that Blair-era reform, and that would be a meaningful upgrade and building on something that was a big step in the right direction.
Yeah, I mean, having used the app recently myself a few times, I think they're going to have to do some work on that to make it work.
It's fairly
properly. It's not great. I mean, for a government IT project, I suppose it could be an awful lot worse. But yeah, not ideal. I mean, I think what I'm struck by here is how much. This is basically an exercise in technocratic managerialism. Now, you're right, there is an element of increasing choice in what was announced by the government, and that's very positive, or at least it's mildly positive. It's a step in the right direction. But most of all, as you say, it's all about the man in Whitehall knows best, this many treatment centres and that many whatever. And that's not really reform. The NHS needs reform. Different forms of the same bureaucratic management aren't really going to move the needle. You might get some incremental gains here or there, but as long as you're trying to run a massive service that employs, like 1 million plus people across the whole country, an extraordinarily complex and varied business, by the way, in healthcare, if you're trying to plan that centrally from the top down, and you're trying to determine, what treatments will be provided, where and by who, in that bureaucratic fashion, it just isn't going to work. Like, it wouldn't work in any other market, and it doesn't work in healthcare. And that's why you end up with the long waits and the inefficient services and everything else. I think reform in healthcare would basically be about trying to liberate the system a little bit, trying to make it so that it is a dynamic system. That it can adapt and it can change and it can try new things. And then, it's not the whole system trying things. It's actually freeing hospitals and particular groups of doctors and stuff just to do things in a different way, or different NHS trusts. Without central government fundamentally letting go of healthcare to some degree. And also, I mean, the thing is, central control is an alternative basically to market choice, right? Because if patients have no choice about what treatment they receive and where, then you're not going to get that kind of dynamic, adaptive pressure within the healthcare system, which drives improvements kind of organically in an evolutionary way. So then the government says, well, we have to plan it and we have to make it better from the top down. But if you can have meaningful choice, where patients are really in charge of their own care to a much greater degree. And then you have the opportunity for different healthcare providers within the NHS, or maybe from outside the NHS as well, to start saying, well, we can do this differently, or we can do this better, and here's how, and the money starts following the patient. Then you get a much healthier kind of system, a much healthier approach to healthcare overall. And I think that's the prize. I think the government is a long, long way off doing that, even if they would ever get there. I mean, public debate in general is a long way from any kind of sort of free market, liberal version of healthcare economics. But I guess an interesting angle on this is that I think it, to a certain extent, that same lack of dynamism you get in healthcare, in a way, that's at the heart of our economic problem as well, I think. That we have an economy which is just sort of depressed and tied up in red tape, and there's just, it feels so much like nothing is happening and nothing is changing, and the energy has kind of gone out of everything. And I do wonder whether there's a common theme just across all of these policy areas of kind of suffocating government control, which is often well-intentioned and meant well, but it doesn't lead to better outcomes in any part of the economy. And so I think just as when we're talking about macroeconomics, the key really is in the long term to just try and really liberate the supply side of the economy, so you can get more dynamism and you can get more growth, and then some of these fiscal problems start to fall away. Similarly, in healthcare, if you really want to make a meaningful difference, you have to liberate the system from central control, and you have to introduce, even if you only want to go sort of halfway kind of mixed economy model, fine, big step in the right direction, you have to have some kind of market mechanisms and price signals operating and competition and choice and everything. Otherwise, you're just talking about a little bit better here, a little bit worse there, and we keep having the same conversation over and over again.
Yeah, and part of the problem is, of course, their rhetoric at an abstract level sounds very much like that. So both Starmer and West Streeting, they've been saying for quite a while now that we will not do what previous governments have done. We're not just going to throw money at the NHS. There will have to be real meaningful change. It's just that as soon as they announce specific measures, it is very much more of the same.
Yeah.
It's always, there are going to be big sweeping reforms, but for now, here's some more money, and here's a new diagnostic center.
Yeah.
And I guess part of the problem is, okay, it's easy to say that in the abstract, we won't just repeat what other governments have done, but you have to steer a system in some way. It's either through central control or market mechanisms. There isn't really a third alternative. And if you're not really prepared to go towards a marketization route, then central control is all you have left. So then, of course, if they shy away from really liberating the supply side, we can't then complain if they just carry on doing what governments have always done.
I mean, there's a clear failure mode here, I think, that cuts across government, which actually this government has been quite good at pointing to things which are broken and being sort of honest about that, and say, identifying we have a real economic growth problem, we're going to prioritise growth. But how are you going to prioritise growth? Well, we'll be competent macroeconomic managers. The NHS is broken. We're going to change it. How are you going to change it? Well, we're going to manage it better than those other guys. Housing even, right? I mean, okay, that maybe there's more room for optimism here than in other ways. But, they realize there's a problem. We need to build more in this country. And how are you going to achieve that? Well, with more targets.
Yeah.
And we'll make the councils do what they're told.
Which as a first step, okay. But so something has to follow then.
Yeah.
Something has to follow.
Yeah. I mean, it's really interesting what you've said about the NHS and what they're doing, because at least suffocated government control, yes, but at least there's at least shoots of trying, or at least making the right noises to go in the right direction. Another thing that was introduced this week, what got its second reading, was the schools bill, which got a lot of attention for other reasons, because it's also where the Grooming Gangs argument came in. But actually, the meat of the legislation is on education reform, and this is a place where the government are going in the opposite direction, where they're looking at something that's actually working reasonably well. Obviously, the education system isn't perfect, but over the past sort of 20 years or so, it's one of the probably few places you would point to say, actually, the government has done something. Governments of all parties have done something. They've built on changes from their predecessors, and it's worked. But the new bill that they've brought forward this week is going to reverse all of that, and it's going to do exactly the opposite of what we're saying we need to do, which is it's going to suffocate the sort of reforms that were made. So just to take a step back, what Blair introduced was academies, which is effectively giving powers to schools and to teachers, taking them away from the control of local authorities and saying you can have control over how much you pay teachers and also control over the national curriculum. We're going to give you, teachers, freedom on how to run your schools, and we're going to hold you to a high standard through sort of serious levels of accountability, through Ofsted and exams and things. But actually, we're going to let you work out how best to do it, and that creates a bit of a market, gives parents more choice over to where to send their kids to school. That was the general ethos that was then started by Blair and was then taken and accelerated by Gove and Cameron in the sort of early 2010s with the free schools agenda and so forth. And now 80% of secondary schools are academies. And it's a little bit less on the primary school side, but generally things are swinging in that direction. And the results are unbelievable. So I've got the numbers here, the PISA rankings, the OECD sort of school rankings. Between 2009 and 2022, for maths, England went from 21st to 7th, in reading from 19th to 9th, and in science from 11th to 9th. Meanwhile, Scotland and Wales, who haven't taken the same approach, have either stagnated or gone backwards. So it's a real sort of, it's quite hard to deny the success that these liberating reforms have had. However, enter the current government and their tendency to sort of suppress things a little bit or suppress freedoms through central power. The schools bill does a number of things, and I won't go. I'm not an education expert, so I won't go into the sort of the full weeds. But a few signifier things I think are worth touching upon. They're removing the freedom over pay from academies, so academies are now going to have to pay teachers at the sort of the national set standard, which means that you take away competition, you take away the ability to attract good teachers, and also you just take away it's just another market mechanism that you're removing that we know works. They're enforcing the national curriculum more stringently onto academies. So instead of saying, look, you're going to have to hit these exams and you're going to get an offset inspection, but beyond that, you can largely teach how you want. They're saying, actually, no, every school is going to have to adhere to the national curriculum, which immediately our classical liberal ears prick up, and we think, well, that's susceptible to politicians meddling and having a new sort of fad every other month. And to lobbying as well. This needs to be more diverse, or it needs to be less diverse, or it needs to include this, or it needs to not include that. And central control brings these problems. And they're also bafflingly giving the Secretary of State ridiculous amounts of powers to intercede over tiny things. So if there are, for example, parental complaints that haven't been dealt with properly, the Secretary of State can get involved. And they're also putting in primary legislation, this is a small example, but quite an indicative example, primary legislation, regulations over school uniforms. You can only have 3 items, for example, that are branded or whatever. And this is a level of government control that is not only negative, but is swinging against, from our sort of ideological perspective, but is swinging in the face of what the evidence has shown, which is lifting these things really liberates schools. And also it removes empowerment from teachers. It stops them being able to have the freedom to use their expertise and tried and tested methods and work out what works and work with other schools and really spend their time doing that. And they're going to have to spend most of their time working out if they're compliant with all these new regulations. Have they got the right amount of school uniforms with the right amount of badges, etc., etc.?
Yeah, I haven't been following this, but I'm just wondering what is the thinking behind this here? Because both in healthcare and in education, the Blair era reforms were basically born out of the same philosophy, the public management school, where you say, okay, we don't believe in privatization, we're not neoliberals, but we'll create something like an internal market. We'll keep public provision, we'll keep a national public network of providers, but we will introduce some internal competition. And by rewarding them in different ways, we can give each provider greater freedom to experiment. Nothing like in an actual market where they can also go bankrupt, or where you can go outside and choose something completely different. So very much constrained and managed competition, but competition nonetheless. So that was the philosophy in both cases, healthcare and education. Now, why would you say, okay, in healthcare, we believe that was the right thing to do, and we'll pick up there again and go further. But in education, we'll do a U-turn and do the exact opposite. So you either believe in this public management school approach, or you don't. What would be the thinking behind saying, in healthcare, yes, right thing to do. In education, no.
It's a really good question. I think one of the problems is that education seems to be quite sort of susceptible to sort of academics and unions having certain views of things, and they seem to have slightly more sway over them maybe in the healthcare space, and because it becomes into an area where you're talking about children, then things can get rather difficult. And I think I like to believe that the education lobby is stronger in most instances than we maybe give it credit for sometimes.
Yeah, I think that it's quite interesting to look back at the success of the coalition and Conservative governments from 2010 in education, because I actually think there's sort of two stories going along side simultaneously. And so one is the one that we tend to focus on, and it's the kind of market-based reform. So it was academization, so giving more independence to state schools. It was the free schools thing, where you could basically set up new schools within the state system, and they would get funding on a per pupil basis, but they would basically operate like academies. They'd be outside local authority control. And so crucially, if you were in an area where, let's say as a group of parents, you weren't happy with the schools that were on offer, you had the opportunity to start your own one that would receive state funding on a fairly equal basis. And the idea obviously was to increase the amount of choice that parents had. And when there was more availability of choice, you could have meaningful competition. And actually, funny enough, I think that's why there was such a particular improvement in performance in London. Because of the population density in London, I think competition between different schools is a much more meaningful thing than it is in many other parts of the country, where, you know, there might be one school for a whole covering a much wider neighborhood and you have to get in your car to go there or something. I mean, I know this is just me going from personal experience, but my son is at a state school in London, and within a 10-15 minute walk of our flat, you know, there were like 8 different acceptable options. So you had meaningful choice, and you could look at the statistics that the government collects and makes available for the different performance of different schools on different measures. And that's great. And now, obviously, it's not the case necessarily that every single parent will do the research and choose, but I think probably more than you think would. And like any other market, if you have enough informed consumers at the margin, they can change the way this market behaves.
You can free ride on them.
You can free ride on them, exactly. And so I think that was great. But there was another side to the Conservative school reforms, which was always happening. But that free schools agenda and the academisation agenda, it kind of ran out of steam around 2016 or so, to the point that I remember when we were both at the Centre for Policy Studies, we published a paper bemoaning the fact, it was probably in 2018 or 19, that we basically weren't opening new free schools anymore. Now, partly that was because there was no money to get them set up. But there was also something else there, right? Which is that alongside these liberating kind of market-style reforms, there was also quite a heavy-handed centralising agenda, even under the Conservatives, where they decided fairly quickly that there was a right way to provide education, and that they wanted as many schools as possible to sign up for it. And it was the sort of very traditional, very academic, strict, uniform, everything kind of approach. And I mean, I know I've spoken to some people who opened free schools early on, and who were really keen on those liberalising reforms. And they said, and I couldn't quite believe this, well, we don't really need the choice and competition anymore because we've had it for a few years and we know what parents like and we know what works, and now we can just force all the schools to do it. And so you're going back into that top-down centralised control sort of thing. And that was really the thing that persisted throughout the Conservatives' time in government, even when those initial Gove liberalising reforms kind of ran out of pace. And the big danger is, yes, you think you know, based on your view of the market, what works best and what people want. But if you leave it up to the Department for Education to define as much as the Department for Education still defines, when another political party that has a completely different view comes in, well, they're going to start imposing their values instead. And I don't know that you really have the right to complain that much about it when you were doing kind of the same thing. Now, for what it's worth, like I say, I would probably want to choose a school that adhered to those kind of traditional academic standards that the last government was pushing. So I'm not criticising them in and of themselves. I don't necessarily think it's right for everybody. It may be what the vast majority of parents would want to choose. But if that's the case, and you have a functioning market, or at least an internal market, then that's probably the direction that things would move in. But you would still have a bit of variety. You would still have the choice. And that I think is the important thing that has been lost. The Conservatives started something very good, and then they didn't complete it. And now I think that the new government is probably going to chip away at it. And maybe we need to have a kind of rediscovery of this whole idea of market-led reform in education. And maybe some future government will go all the way.
I think it's a good point. And actually, come back to what you said as well, Kristian, I think it's probably indicative of the fact that they're sort of taking one approach in healthcare and one approach in education. It's indicative of the lack of overarching ideology, mission, whatever you want to call it, that Blair had, Conservatives messed around with. And I think this government is lacking in that actually you've got Wes Streeting. It's almost driven by personalities and which approach this certain Secretary of State would want to take as much as it's about anything. But it's an interesting experiment to see which has more success, I guess. I'm obviously not that comparable between NHS and education, but very different approaches.
I mean, bear in mind, though, Blair really got hot on the public service reform agenda in his second term and in his third term. Initially, actually, they did many of the same sort of things that the government is doing now, because John Major in the 1990s had done, maybe it started under Margaret Thatcher, but I think it was mostly in the Major years, some market-based reforms in healthcare, some market-based reforms in education. Labour came in 1997. They immediately reversed all of that, more or less. And then a few years later, I think Tony Blair and others realised that had been a total mistake. They'd basically done what the unions and the interest groups wanted them to do when they first got into power. Then they realised it didn't work. But then Blair and others thought, well, actually, no, we're going to have our own public service agenda around choice and competition and accountability. And that's going to drive improvements in standards. Of course, Blair also had the luxury of being able to spend a ton of money on public services as well. And so reform is always easier to deliver, but easier to get past the interest groups if it's accompanied by a big wad of cash. And I think we can rightly bemoan the cash that the new government has already thrown towards public sector workers and so on, while raising taxes and while they have a sort of fiscal problem. But in the grand scheme of things, they don't have that kind of money to play with. So it's still possible that they will change course, as Blair did, but I think they will find it very much harder to overcome the obstacles, the political economy obstacles that are always going to be there.
Well, even if they do, one problem with these sorts of reforms is they take some time to settle in. And if you then have this zigzag course where you bring in some internal competition, then you reverse it again, that was a problem with the initial Blair years. Ideally, they should have just built on and improved the version of it that they already inherited from the Major years, rather than in the first term reversing it and then building a new version of it from scratch. We could be much more advanced already in this agenda if there had been a greater degree of policy continuity, if there had been a recognition that, okay, this is a different party, and yes, we're rivals, and we've just had a general election where we were slacking each other off, but nonetheless, we have to accept, actually, here we believe in broadly in the same thing. The idea in both cases was that if you give people choice, then this is going to put pressure on providers, even if it is in the public sector, and that they will maybe not behave like a profit-driven company, but they will adapt to what consumers want. So up to a point, treating patients, treating parents of school children as consumers. And that was the whole philosophy behind this, and it worked in both cases. It's just, it takes a while to settle in. It takes a while for that to have an effect, and you need to give it the time to work, and not ideally not constantly go back and forth between strengthening the internal market and then rowing back from it again.
There's one other thing I'd like to bring up on healthcare, and something a subscriber emailed me about earlier in the week, actually. With the problems that the NHS is having at the moment, like long waiting lists and being very difficult to get a doctor's appointment and everything, you are seeing more and more people, and especially younger people, I think, going to see private GPs and paying for their appointments, taking out private medical insurance so that if they need an operation, they don't have to wait on an NHS waiting list for a year or more. Now, a lot of people will obviously say, look, isn't this awful? People are being forced to go to the private sector because of the failures of the state sector. Now, you would obviously want the NHS to work as efficiently as possible. But equally, I think this is quite a good thing if more people are going private. And I would suggest that this is something that any government should lean into. If someone is saying, like, I can afford to pay for my own healthcare, and so I'm going to go and do exactly that, and I'm going to get the kind of treatment I want when I want to have it, this is an extremely good thing. And so I would want to be thinking, like, how can we accentuate this trend? If more people are willing to take out private insurance, and by the way, in doing so, take a potential burden off the NHS, if they're willing to see a private GP, well, great, because then there are more appointments available for other people who maybe can't afford to pay while we have this system. This is great. This should actually be a win-win-win all round. And I would just like to think a little bit, and maybe it's something we can do here at the IEA, about how can you incentivize more people to go private when they have the means to do so, and try and develop. By some standards, we have a fairly well-developed private healthcare system in the country, but I think it could be a lot bigger, and it could be a lot better, and it could be serving a lot more people. And maybe we could move over time to a system which is much more mixed. And I think Australia has some sort of version of this, right, where most people who can afford to pay for private insurance pay for private insurance, and they get treated privately. And the sector which is sort of controlled by the state dwindles in relative importance. It seems to me that we have an opportunity to do that right now. The obvious way to speed things up would be to give some sort of tax incentive to encourage people to take out private insurance, or some kind of membership subscription with a private GP service. I've seen those starting to emerge, particularly in London at the moment, where you can pay a fee like £150, £200 a year to be able to see doctors whenever you want in a private clinic. Great. Now, I think given the fiscal situation we're in, you'd probably want to try and work out exactly what sort of incentive can you create so that you're saving the NHS money for the cost of your tax incentive, rather than simply adding another cost on government. But that seems like a promising area for exploration.
And it's already having a positive effect in that West Streeting is using this to the fact that some people are going private. He's using this to justify the choice-based part of his reform and his willingness to have contracts with private providers. He is saying, look, some people are doing this already. It's mostly fairly affluent people. If they can have it, why shouldn't it also be possible for NHS patients? That may not really be the reason why he wants to do it. Maybe he does believe in the old Blairite internal market approach, but he is using the fact that some people are going private as a way to justify what would otherwise be, or what is very unpopular with parts of his own party.
It gives him the political cover to do it.
Well, here again, though, what a dichotomy between healthcare and education. Because in education, you had lots of parents who are sending their kids to private school, and that's per child saving state education, like $7,000 per year per child. Now, Labour is taking away the tax advantages that private schools had. And I think you can argue that the tax advantages that private schools have are probably not the exact tax advantages that you would design if you were starting from scratch. I think there would possibly be better ways of doing it. But leaving that aside, you have something where you're making it harder for people to opt out of the state system, and in so doing, save the state money.
And it comes back to, arguably, it comes back to ideology, doesn't it? I mean, it's quite easy for a government of Labour stripe to sort of bash private providers in education, but also in healthcare. They are making the right noises about using private healthcare and more private provision to help the NHS now. But 20 years down the line, when we've moved to a good operating mixed model through tax incentives to make people go private, you could just imagine what might appear on any party's manifesto, frankly, to take from people who can afford private healthcare to give back to our NHS. That's getting a few steps ahead, though.
Don't happen.
Yeah, we'll deal with that one.
I'm afraid that's all we've got time for today on the IEA podcast, but thank you for joining us. If you'd like to hear more from us, you can go to our website at iea.org.uk or follow us on Substack at IEA Insider. Thanks very much.